This week, we are talking about news literacy, and part of that involves knowing where the information that you read or hear is coming from.
The spread of inaccurate misinformation throughout the pandemic has created lots of problems in the healthcare community. Tallahassee Memorial Healthcare has been working to bust pandemic myths and get reliable information to families in the Big Bend. Their COVID-19 dashboard is just part of that effort. Tonight, it shows 92 COVID-19 patients in their care, 30% of whom are vaccinated. They tell me checking up on where your news comes from could help bring these numbers down.
Yeah, there's a lot of misconceptions and myths, beginning with the fact that a lot of people don't believe COVID exists.
Dr. Dean Watson, Vice President and Chief Integration Officer at Tallahassee Memorial Healthcare and Capital Health Plan, says the virus is very real.
Will I become magnetic? Are there microchips? Will the COVID vaccine give me COVID?
Questions he hears often. Sadly, the misinformation surrounding COVID is just as real as the virus itself. What kind of harm does misinformation pose to society?
That's huge. So misinformation leads to disbelief, distrust. Many people have lost their lives or are now disabled because they really had some major misinformation related to vaccine.
Research proves it's happening. A study by the Kaiser Family Foundation shows 38% of Americans believe the government has exaggerated the number of COVID-19 deaths. 17% believe pregnant women should not get the COVID vaccine. 7% believe the vaccines contain microchips. All things that science has shown is not the case.
And when we're out trying to help and to guide through evidence-based practices, it's very difficult to have those communications when people have a true belief that has no evidence basis behind it.
So you think misinformation is killing people?
I think that it is very impactful. I think misinformation will lead to worse outcomes, correct.
Something doctors, nurses, and healthcare communication directors like Stephanie Derzapolsky are working to prevent. How does it feel when you do hear the reports about the misinformation going out there and people believing things that are just blatantly false?
It can be frustrating. I try to be patient with people.
She's charged with getting accurate information about the state of the virus out to the community, taking on dangerous, unproven COVID prevention methods like putting household cleaners directly on skin or swallowing disinfectants to prevent the virus. The CDC said this led to a big increase in calls to poison control centers in 2020.
I think it's been hard on everyone who's had to go through this. Their children, people in the community.
It's a constant challenge getting ahead of the conspiracy theories and outright lies about the virus circulating as quickly as COVID itself.